Periodontal probe assessment, armamentarium, PPE, consists of face shield, eyewear and side shields, face mask, gloves, and gown. Patient PPE, patient glasses, patient bib, bib easy, saliva ejector, HEV tip, air water syringe tip, marquee periodontal probe instrument, mouth mirror, neighbor's probe if needed, and floss. The marquee periodontal probe is an assessment instrument that is double-ended and unpaired. It has a simple shank that is circular in cross-section. The working end is blunt and rod-shaped with markings for millimeters. The colored markings are in 3 millimeter increments up to 12 millimeters. There are no cutting edges. Findings with the probe are used to determine tissue health by making intraoral measurements. Measurements of the sulcus and pocket depths, clinical attachment level, size of oral lesions, and longitudinal response of periodontal treatment. It is also used to determine the width of gingiva and used to assess for bleeding and purulence. We can demonstrate the tension test, which is used to determine the tightness of a frenum, which can cause recession. And we can also test for mobility, which is done using the ends of single-ended instruments. Class 1 mobility, the tooth can be moved less than 1 millimeter in any direction. Class 2, the tooth can be moved under 2 millimeters in any direction and is not depressible in the socket. Class 3, the tooth can be moved greater than 2 millimeters in any direction and is depressible within the socket. We can also test for the width of the attached gingiva, which is used to measure the total width of gingiva from the free gingival margin to the mucogingival junction. We subtract the pocket depth from the total width of the gingiva. We can also use floss to test open contacts for areas of food impaction. We can also use the probe to test for spaces, such as diastemas, to measure their size. With the probe, we can also measure the clinical attachment level, or CAL, which is the distance from the cemento-enamel junction to the depth of the pocket. If the gingival margin is at this CEJ, then CAL is equal to the pocket depth. If there is recession, then you add the amount of recession to the pocket depth. If there is overgrowth of the gingiva, you subtract the overgrowth from the gingival margin to the CEJ from the pocket depth. We can also use a special probe called the neighbor's probe to test for furcations. This probe is used as it is rounded and can reach into furcations. A Class 1 furcation, the involvement is beginning and it can be detected but cannot be entered and is not seen on radiographs. Class 2, you can enter the furcation from one aspect but you cannot go through it and it is still not seen on radiographs. Class 3, you can now go through the furcation, however there is soft tissue covering it, and this is the first time it is seen on radiographs as radiolucent. Class 4, you can go all the way through the furcation and there's no longer tissue covering it. Prior to starting, I would also ask the patient if they have any past or present issues with their gum tissue and health, or if they've ever had any periodontal treatment in the past. While probing, we are assessing for the pocket depth on both the lingual and buccal side. There are a total of 6 areas that we are performing the insertion and making sure that we are documenting the proper depth of the pocket if there is one. We will also record any bleeding or purulence that occurs and the location on the tooth in which it occurs on. ambidextrous pockets are around 3 millimeters, and there is no bleeding or suppuration occurring. Maintain asepsis.